Hello, my dear doctors, welcome back. And I think if you people remember, in the last class also we were actually discussing about the general embryology part. So let us continue our discussion regarding the general embryology. So in the last class, I told you that in general embryology, we are actually going to learn about the first week and then the second week and third week of development. You know? Now, in this first week, second week, and third week of development, let's have a quick revision of that one, whatever we have learned in the last class, and then we'll actually continue ahead. Fine. So if you people remember, in the very first week of development, I told you the main important event that is going to take place. There'll be like two events taking place. Number one, fertilization, and number two will be the implantation. Yes, Dr. Anish. Yes, thank you. So let's have a quick revision of that one because embryology is all about like continuation only. तो वहीं से हम उसको आगे continue करेंगे. We are going to continue further from there itself. Fine. So now, quickly, if you have your notes along with you, please revise along with me. Number one, in the very first week, we were having like fertilization and implantation. I told you that fertilization will take place on day one. And once the fertilization will occur, the result of the fertilization will be zygote. And then zygote will multiply to form like morula, which will be having 16 cells in that one. And that morula will further multiply to form late morula or advanced morula. I told you that there will be 32 cells in that one. Now that late morula is going to actually enter into the uterus from the fallopian tube on day 4. Fourth day it is going to enter there. And after entering, what is going to happen? It is going to become blastocyst. Blastocyst will have that outer cell mass and then there will be inner cell mass and then it is having fluid filled cavity. There'll be fluid filled cavity in that one, blastocele. And that blastocyst is the one which will get implanted. And I even told you that the implantation will take place on day 6th day implantation will begin and it is going to complete by 10th day. Okay, 10th or 11th day the implantation will get completed. And now what is the site of implantation? I told you the site of implantation is exactly at the junction of fundus and the body of the uterus. On which wall? On the posterior wall. So at the junction of the fundus and body of the uterus, on which wall? Posterior wall. Exactly what will happen? Implantation will take place. Now, once it get implanted, from there onwards begins your second week. And I told you in second week, there'll be formation of bilaminar germ disc, if you remember. Now, in that, what is going to happen? Inner cell mass, only one layer is going to become hypoblast and the remaining cells are going to become your epiblast. That is your bilaminar germ disc. Outer cell mass, so already I told you it is going to become trophoblast. Outer cell mass is going to become trophoblast. Fine. So inner cell mass is the one which is going to form your epiblast and hypoblast. तो मैंने आपको ये भी बताया था कि what is another name of that one? Hypoblast. Hypoblast is referred to as what, guys? Yes, primitive endoderm. Whereas the epiblast, yes, whereas the epiblast is actually referred to as the primitive ectoderm करके मैंने आपको बताया था. Fine. Then after that, what will happen? After that, there is a formation of mesoderm, and in the second week, yes, there is a formation of extra embryonic mesoderm, right? So extra embryonic mesoderm form होता है. Now, after that, yes, the extra embryonic mesoderm is going to divide into two layers. With the help of that extra embryonic coelom, it is dividing into two layers. The extra embryonic mesoderm, which is surrounding the yolk sac, around the yolk sac, that will be referred to as what? That is referred to as your splanchnopluric extraembryonic mesoderm, whereas the remaining mesoderm will be referred to as the, yes, the somatopluric extraembryonic mesoderm. ठीक है ना? I think आप सारे diagrams देख रहे हो notes में. I hope you're able to see all the diagrams one by one in the notes. And then later on, what is going to happen, my dear friends? After that, I told you about the amnion and the chorion. What is that amnion made up of? Remember, amnion is made up of amniogenic cells along with somatopluric extraembryonic mesoderm. And whereas the chorion is actually made up of what? Trophoblast. And trophoblast along with, yes, somatopluric extraembryonic mesoderm. तो amnion और chorion भी हमने पढ़ रखा था, है ना? Fine. And from there we went on to the third week. In third week, I told you there are like three things there. One is prochordal plate. Hypoblast जो होता है ना, in the hypoblast, some of the cells are modified into tall and columnar cells, and they are referred to as prochordal plate. And what is the use of that one? What is the function of the prochordal plate? It is helping in deciding the craniocaudal axis of embryo. Wherever the prochordal plate is forming, that end will be the cranial end, and the opposite end will be the caudal end. And then, my dear friends, remember in the epiblast, there will be primitive streak cells and the primitive knot. Primitive knot is also referred to as Hansen's node also. Now the primitive streak, it is the one which is going to form all three germ layers, ectoderm, endoderm and the mesoderm. And primitive knot is going to form the notochord in the middle. Notochord in the middle. Hai na? So I told you about all these things in the last session, if you remember very well. Is it okay, my dear friends? Very clear now? So once you are done with all these things over here, now we are going to continue from there itself. Let us go in depth right now. थोड़ा सा revise हो गया? Just answer your things in the chat box there, my dear friends. Just I want your responses in the chat box there. I hope ये सब कुछ revise हो गया है. I hope you are able to revise all these things. Now you are in the mood of studying right now. हाँ, हम वहाँ से कंटिन्यू करते हैं और ये आपको मैं बार बार इसीलिए पूछ रहा हूँ कि रिवाइज हो गया है कि नहीं, क्योंकि इट्स एम्ब्रियोलॉजी एंड एम्ब्रियोलॉजी इज ऑल अबाउट व्हाट गाइस, कंटिन्यूएशन. हम वहीं से आगे कंटिन्यू करेंगे. वी आर गोइंग टू कंटिन्यू फ्रॉम देयर इटसेल्फ. इज इट ओके? तो अगर आपने ये रिवाइज नहीं किया है तो फिर दिक्कत हो जाएगा फिर आगे आगे समझने के लिए. मतलब आज टुडे वी आर गोइंग टू गो इन मोर डेप्थ राइट नाउ. चलो जी, थैंक यू फॉर योर रिस्पॉन्सेज देयर. एंड नाउ लेट्स कंटिन्यू अहेड माय डियर फ्रेंड्स. ओके. Now, first of all, if you recall in the last class, what I taught you was there was a hypoblast here. Hypoblast will normally have the cube-shaped cells. Some of the cells are going to modify into tall and columnar. That is known as the procaudal plate. Fine. ये मैंने आपको बताया था. This is like procaudal plate. Now that procaudal plate, wherever it is forming there, that end will be the cranial end. Now I told you that the epiblast cells will proliferate and move forward. And after moving forward here, what is going to happen? They will be forming a dense mass of cells in the middle. And now the remaining cells will remain as tall and columnar here. So now whatever these cells are going to multiply and move forward, they will be referred to as primitive streak. And these cells here, they will be referred to as the primitive knot. ये आपको diagram याद होगा. Now in this diagram, I told you that the primitive knot is the one which is going to form your notochord in the middle here. Notochord in the middle here. Fine. Now this diagram of the embryo is actually in the longitudinal section. Longitudinal section मैंने आपको बताया भी था. You suppose my hand here to be the endoderm here, and this is your ectoderm here, in the middle mesoderm, and you imagine my pen here to be like the notochord in the middle. Sir. Fine. So it is like this we are cutting here, longitudinal section. अब हमको क्या करना होगा? We have to take the transverse section of this one here. Now we have to take the transverse section of the embryo. So now exactly this diagram that you're able to see on the screen here, this diagram is actually the transverse section here, sir, this one. तो ये वाला longitudinal section है, this one is the longitudinal section here. इसी को अगर आप transversely cut करोगे तो यहाँ नजर आएगा. So this layer that you're able to see above here, this one is your ectoderm here, and this one here will be the endoderm here, and you can see the primitive streak is the one which is going to multiply and form these cells in the middle. That is going to form your mesoderm there, sir. That is going to form mesoderm. Are you understanding now in the diagram in 3D? So in our books, we are drawing like simple diagrams here. Like in the image here, you are able to understand the diagram actually. Fine. So in this diagram, we are actually seeing the transverse section. Now recently in the exams, what they are doing is they are actually using this diagram here for the transverse section of the embryo. Wow. Look at this diagram here, sir. That is the transverse section. Now in this transverse section, my dear doctors, first what you do is just you listen here for a couple of minutes. You just listen here. I'll make you draw this diagram. At that time, we can write down the notes together. Fine. Now in this diagram, you're able to see this germ layer here is actually your ectoderm here. And this one here will be the endoderm here. And finally, this one here will be the mesoderm. Fine. There are like three germ layers, ectoderm, endoderm, and the mesoderm. Fine. Now in this one, in the transverse section, the first thing that you should be able to identify here is this one here will be the notochord, my dear friends. This one here will be the notochord. Sir, why is that notochord visible like that here? Why? Because I told you, if you see in the longitudinal section, you'll be able to see the complete notochord. In the longitudinal section, you are able to see the complete notochord here. ये complete आपको नजर आ रहा है यहाँ पर, ठीक है ना? There's the complete notochord over here. Fine. Now suppose if I am cutting it like this here, transverse section. If I am cutting it in the transverse section here and turning towards you like this here, so you will not be able to see the entire notochord. No. You're able to see only this much part here, sir. Only this part is visible here. Are you understanding in the transverse section? That is how you identify the notochord here. तो एक बार मैं दोबारा repeat करता हूँ. It's worth repeating here. In the longitudinal section, you're able to see the entire notochord, but whereas in transverse section, you will be able to see only that much part of the notochord there. Perfect. Now above the notochord here, this part here will be the neural tube. This part here will be the neural tube. Okay, don't worry about this neural tube right now because I am going to tell you about this neural tube within few minutes. Today I'll tell you how that neural tube is actually forming cell. I'll tell you in a crystal clear manner how it is forming. Clear? Then after that, my dear friends, now welcome to this mesoderm. First, let us learn about this mesoderm here. I hope you all remember from our last class, I told you in second week there is a formation of extra embryonic mesoderm. Embryo के बाहर form होता है. Now in the third week here, it is actually inside the embryo. So this one is definitely your intra-embryonic mesoderm. Intra-embryonic, no doubt about that. This is intra-embryonic mesoderm. Now this intra-embryonic mesoderm is in turn divided into three parts here. This part that you're able to see here, it is known as the para-axial mesoderm. Para means always along the axis, para-axial mesoderm. And this one here will be the intermediate mesoderm. It is in the middle, intermediate mesoderm. And then this one here will be the lateral plate mesoderm. What is that one? Lateral plate mesoderm. Fine. So one is your paraxial mesoderm, intermediate mesoderm, and lateral plate mesoderm. So intra-embryonic mesoderm is divided into how many parts, my dear friends? It is divided into like three parts here. So the first thing that you have to learn here, as I told you in the last class also, in the second week everything is like double, and in the third week everything is like triple. Understanding? So you can see here in the third week, intra-embryonic mesoderm is also actually divided into how many parts? It is divided into like three parts: paraxial mesoderm, intermediate mesoderm, and the lateral plate mesoderm. Paraxial, intermediate, and lateral plate mesoderm. Clear with this one here? अब चलिए हम एक काम करते हैं. Once you have understood this diagram in the textbook over here, let's draw this diagram together. चलिए हम लोग मिलकर ये diagram को draw करते हैं. And now you people start drawing the diagram along with me. Okay. Now, first of all, my dear friends, in that diagram, मान लो कि this one here will be your ectoderm here, and this one here will be the endoderm here, and then somewhere here will be the notochord here. Notochord here. Fine. So let us write down here, my dear friends. So this one here will be the ectoderm. This one here will be the endoderm, and in the middle you're having the intra-embryonic mesoderm. That is your mesoderm. And this one here, I told you very clearly, this one here will be the notochord. Notochord. Right now, in our diagram, we are not drawing the neural tube here. Why? Because neural tube is not yet formed there. Fine. So you just imagine that is your notochord there. Here, we are not drawing the neural tube till now. Now our main concentration is about the mesoderm here, my dear friends. What is going to happen to this mesoderm? It is again divided into like three parts here. This is number one here, number two here, and मान लो कि this is number three here. And the same thing will happen on the other side also. Number one here, and this is number two here, and this one is number three here. Fine. Now this number one here, this one here will be the para-axial mesoderm. I told you the name is very much meaningful here. Para, along the axis, para-axial mesoderm. And this number two, the second one here is in the middle. So therefore this one will be the intermediate mesoderm. This one is intermediate mesoderm. And similarly, number three, this one here will be the lateral plate. So this one here will be the lateral plate mesoderm. Lateral plate mesoderm. So intra-embryonic mesoderm is actually divided into three categories here. Number one, there is paraxial mesoderm. Number two, there is intermediate mesoderm. And number three, there will be lateral plate mesoderm. So it's divided into like three parts here, sir. Perfectly done. Now once you are done with this one here, now let us see what is derived from here. अब एक बारी अगर आपने diagram अच्छे से समझ लिया ना सर, अच्छा, don't forget that this is which section of the embryo? This is transverse section of embryo. This is the transverse section of embryo, sir. Fine, transverse section of the embryo. So in that, the intra-embryonic mesoderm is divided into how many parts? Three parts. First, aram se you learn the names. Now after learning the names, I'll tell you how to deal with this one here. Now how to deal with this one? What is derived from here? So first what you do is you start from intermediate mesoderm. Intermediate mesoderm is the one, it is in turn going to form like two structures here. Now one structure here will be the nephrogenic cord. Intermediate mesoderm is going to form number one, nephrogenic cord, and number two, it is going to form the genital ridge. Nephrogenic cord and genital ridge. Okay, and my dear doctors, Learn it for once and forever from today onwards that genital ridge is the one which is going to form the gonads. Genital ridge is the one which is going to form the gonads. So the male gonads testis and the female gonads, the ovaries, are derived from genital ridge. It is going to help you till your final year. फाइनल ईयर जब आप ऑब्स गाइनी पढ़ोगे ना, ओबीजी पढ़ोगे, तो ये तब भी आएगा कि गोनाड्स, मेल गोनाड्स एंड फीमेल गोनाड्स कहाँ से फॉर्म होते हैं. तो आज से आप ये वर्ड याद रख लीजिए. प्लीज रिमेंबर दिस वर्ड, इट इज जेनिटल रिज. So genital ridge is going to form gonads. You can always answer anywhere. Suppose in the Viva exam also, if they're asking you, okay, gonads are derived from where? Answer is genital ridge. Now please look at the another word there. Another word, nephrogenic cord. What is the meaning of nephro? Nephron, kidneys. And then genic, generation, formation. Nephrogenic cord. Acha, that is the one which is going to form your kidney. That means that is belonging to your urinary system. It is going to form your kidneys and all those things. Later on, we'll study in the systemic embryology. Fine. So my dear friend, from here, I am able to understand that nephrogenic cord is concerned with your urinary system, the uro, and genital ridge is concerned with the genital system, therefore genital, urogenital system. Okay. So intermediate mesoderm is concerned with the development of urogenital system. Intermediate mesoderm is concerned with the development of urogenital system. पहले आप इसको खत्म कर लीजिए. First you learn about intermediate mesoderm. That's all. Finish. It is done. Are you understanding me? I repeat again, neat and clearly, my dear friends. Intermediate mesoderm is going to form nephrogenic cord and genital ridge. And out of these two, remember, they are the one. Nephrogenic cord is going to form kidney. Genital ridge is going to form gonads. So therefore, they are concerned with development of urogenital system. अगर आपको याद होगा, I told you very, very clearly that in general embryology, we'll be learning only about the first week, second week, and third week. And from third week onwards, yes, slowly, what is going to happen? Your systemic embryology is going to begin. Understanding? And now you can see the result of that one. From third week onwards, अब यहाँ से systems form होना start हो जाएंगे. Systems will start forming from here. Fine. So intermediate mesoderm is going to form these two structures. They're going to form urogenital system. Fine. Next one. After learning this one, welcome to paraxial mesoderm. Now, you need to understand one thing here. First thing is that paraxial mesoderm, it is the one which is going to form somites. अब ये word बहुत important है sir. Please remember this very carefully. It is going to form somites. अब यार ये somites क्या होते हैं? What is the somites? Okay. First, you need to understand this diagram very carefully. Orientation very carefully. So please look at me here right now. मान लो कि my this hand here is endoderm and my this hand here is ectoderm, and in the middle you are having mesoderm. Now this is the notochord present here. I want you all to imagine in 3D right now. Okay. So endoderm, ectoderm and the mesoderm, and in the mesoderm in the center you are having this notochord here. Notochord. अब मैंने आपको क्या बताया था? Just adjacent to this notochord, what do you have? ये notochord अगर होगा तो इसके साइड में क्या होगा? What is this here? Paraxial mesoderm. Okay, imagine. So there is a paraxial mesoderm here, paraxial mesoderm here. Then you have intermediate and intermediate on both the sides. Then lateral plate and lateral plate mesoderm on both the sides. Okay ना? So paraxial, intermediate, lateral plate दोनों साइड में भी होता है. Fine. Now what is going to happen? Just adjacent to notochord, whatever this paraxial mesoderm is there, that is going to modify into spherical ball-like structures. And those spherical ball-like structures are known as somites. They're known as what? Somites. Are you getting me? तो अब मैं आपको ना एक बेहतरीन सा पिक्चर बताता हूँ. I'll show you one beautiful picture over here. Whereas embryo हम क्या करेंगे? ऊपर से ये ectoderm निकाल देंगे. So you imagine that this hand here, ectoderm I have removed from here. After removing that ectoderm, I am now seeing that embryo from above. हम ऊपर से देख रहे हैं. ठीक है ना? तो we are seeing from above. So please look at this diagram here. Beautiful. So we have reflected the ectoderm from here. हमने यहाँ से ectoderm निकाल दिया है. And after removing the ectoderm, in this diagram, this in the middle will be the notochord. Now just adjacent to the notochord, there will be paraxial mesoderm here, and there is a paraxial mesoderm here. Are you understanding me? Now this paraxial mesoderm on both the sides here, it's modifying. It's modifying into slowly, you can clearly see here, it is modifying into spherical ball-like structures. And these spherical ball-like structures are known as what, guys? Somites. What are those? Those are nothing but the somites. So just adjacent to the notochord, you'll be having those paraxial mesoderm, and that is modified into somites. Are you getting, my dear friends? Come on, are you understanding here? So that is how the somites are formed. So the same diagram which I have shown you there, if you want to just understand as if we are seeing from above, So this one here in the middle will be the notochord. On both the sides, we're having paraxial and paraxial mesoderm here. And this paraxial mesoderm is going to slowly modify into the spherical ball-like structures known as the somites. So it is going to form the somites here. Perfect. So this one here will be nothing but your somites here. Now, once you have understood those somites, initially there will be like so many of them, almost like 40 to 44 somites are there. Their numbers are variable, but later on they are going to reduce down to like 30 to 36. Okay, fine. So those numbers are there. Fine. Now that spherical ball-like structure, somite, is in turn divided into three parts here. It is in turn divided into three parts. Okay, and I'm just drawing a general diagram like that for our sake of understanding. Fine. Now, this somites are in turn divided into how many parts? Three parts. And those three parts are, number one, they will be dermatome. Number one, they will be dermatome. Number two, they will be sclerotome. And then number three, you'll be having the myotome. So there'll be dermatome, sclerotome, and the myotome cell. Fine. Now from the name itself, you're able to understand that derma, that means it is going to form the dermis. Okay. So this is going to form the dermis of back of the body. Dermis of back of the body, sir. Only the back of the body. Don't look at the word as derma there and tell like skin. It is going to form skin karke, because you know the different layers present in the skin. You'll be having dermis, epidermis, and all those things. Be specific there. So many students I have seen, they'll be just in generally telling like, that is going to form the skin. No. It is going to only form the dermis of back of the body. And sclerotome is the one which is going to form the axial skeleton. Axial skeleton. Now I hope ये तो आपने जनरल एम्ब्रियोलॉजी जनरल एनाटॉमी में इतना तो पढ़ा होगा स्टार्टिंग में कि axial skeleton will be the skeleton present in the center, like the vertebrae and the sternum and the ribs. All this comes under axial skeleton. And whatever bones that you have in your upper limb and the lower limb, that is known as appendicular skeleton. So axial skeleton is formed by sclerotome. And myotome is the one which is going to form the muscles, and it is going to form mainly the skeletal muscles. So in our body, we have got like three types of muscle: skeletal muscle, smooth muscle, and cardiac muscle, and they are going to form the skeletal muscle. I hope you did not forget the sequence here. What are we learning? Okay, we are learning about the intra-embryonic mesoderm. Intra-embryonic mesoderm is in turn divided into how many parts? Three parts. Out of the three parts, first I told you what to remember: intermediate mesoderm. It is going to form urogenital system. Now forget about that one. Usko bhul jao. Forget about this intermediate wala. Now deal with the paraxial. Paraxial mesoderm is in turn dividing into somites. Very, very important for your prof exams also. They might ask you a separate short question about the somites also. The somites will in turn have three parts. One is dermatome, and then sclerotome, and then myotome. Derma, it is there in the word itself. It is going to form dermis of back of the body. Sclero, you remember skeleton. Scleroskeleton. Sclerotome is going to form your axial skeleton. And myo itself means what? Muscle. It is going to form the skeletal muscle. अगर आपने ये सीख लिया है, if you have learned this one here, my dear friend, now everything else will be derived from where? Yes, dump it into the lateral plate mesoderm. Yes, ये होता है पढ़ने का तरीका. That is the way how you have to learn this one, sir. ठीक है ना? So all the remaining things from here will be derived from the lateral plate mesoderm. Sir, what do you mean by all the remaining things here? Welcome here. Number one, dermis of front of the body. Dermis of front of the body will be derived from where? Lateral plate mesoderm. Then appendicular skeleton is left out. It is derived from where? Lateral plate mesoderm. And then smooth muscles and cardiac muscles are left from here. That is derived from lateral plate mesoderm. ये होता है पढ़ने का तरीका. Are you understanding, my dear friends? Are the things becoming easier for you right now? So everything else will be derived from the lateral plate mesoderm. But there is a catch here. अब आपको लग रहा होगा ओहो ये तो इतना आसान हो गया. No, the moment one thing is made easy, another thing will be ready here, sir, in anatomy. Okay, so let us go in depth right now. There is a small catch here. Okay, are you interested in learning a little bit in depth? Shall we go a little bit in depth right now? Now, in this diagram, अगर आप, sir, this topic is very easy. Thank you. Now, in this diagram, अगर आप यहाँ पर lateral plate mesoderm को ध्यान से देखोगे, if you observe this very carefully there, it's again divided into two layers. Okay, I hope you're able to see one layer here. Okay, and I hope you're able to see like one more layer over here. It is divided into two layers, and this is divided into two layers with the help of a cavity in the middle, and this cavity in the middle is of course coelom, and that coelom will be the intra-embryonic coelom. That coelom will be intra-embryonic coelom. जैसे हमने सेकेंड वीक में पढ़ा था ना एक्स्ट्रा एम्ब्रियोनिक coelom करके, similarly this one is intra-embryonic coelom here, sir. Are you getting my point here? So because of the intra-embryonic coelom, the lateral plate mesoderm is again divided into how many layers there? It is divided into two layers. Okay. And now this layer which is along with ectoderm, this layer which is along with ectoderm, that is known as somatopleuric. I told you the word somato refers to the body wall. So it is present along with the body wall, along with the ectoderm. So the layer present along with the ectoderm will be somatopleuric lateral plate mesoderm. And this layer which is present along with the endoderm, ये endoderm के साथ में है, towards the organs, that is splanchnopluric. That is splanchnopluric lateral plate mesoderm. Are you understanding? Now please don't get confused with somatopleuric and splanchnopluric we learned in second week. You can turn the pages back and see in the second week. We have learned there, but that is somatopleuric and splanchnopluric extra-embryonic mesoderm. And this one is somatopleuric and splanchnopluric lateral plate mesoderm. It is not extra-embryonic mesoderm, it is lateral plate mesoderm. I hope I'm not confusing you. That was in second week. Now this is actually in the third week right now, sir. वो सेकंड वीक में था और ये थर्ड वीक में है, ठीक है ना? तो एक बार दोबारा कर लेते हैं. नाउ वी आर गोइंग टू लर्न अबाउट द लेटरल प्लेट mesoderm, एंड लेटरल प्लेट mesoderm इज इंटर डिवाइडेड टू हाउ मेनी लेयर्स हियर? टू लेयर्स. ओके, तो चलिए अब हम बढ़ते हैं आगे इन आवर डायग्राम हियर, इन आवर सिंपल डायग्राम हियर सर. तो अब हम इसको ना एक बार दोबारा ड्रॉ करते हैं. आई एम डन विद द इंटरमीडिएट mesoderm, आई एम डन विद द पैराक्सियल mesoderm. नाउ वी आर वर्किंग आउट ऑन द लेटरल प्लेट mesoderm. ठीक है, चलिए सर. Now I'm going to use the same colors again here, my dear friends. Ectoderm here, and this one here will be the endoderm here, and then in the middle here, this one will be the notochord here, sir. And then you will be having your paraxial mesoderm number 1, and then the intermediate mesoderm number 2 here. And then what is happening with the lateral plate mesoderm? Let me take another color here. Lateral plate mesoderm यहाँ पर ये दो layers में divide होता है. Okay, and how it is divided into two layers here? It is divided into two layers with the help of a coelom in the middle here, and this coelom will be referred to as intra-embryonic coelom. Intra-embryonic coelom inside the embryo, and this layer which is present along with ectoderm, somatopleuric lateral plate mesoderm, and this layer which is along with the endoderm, this one will be the splanchno. So this one here will be the splanchnopluric lateral plate mesoderm. Okay, so intra-embryonic coelom is divided into two layers there. पहले आप आराम से इनके नाम याद करिए, ठीक है ना? Somatopleuric lateral plate mesoderm. Somato is always representing what? It is representing the body wall. तो ये ectoderm के साथ में होगा. और स्प्लैंक्नो इज रिप्रेजेंटिंग द विसरल ऑर्गन्स, तो ये एंडोडर्म के साथ में होगा. चलिए, अगर आपने ये सीख लिया है, नाउ लेट अस सी द डेरिवेटिव्स. अब यहाँ से फॉर्म क्या होगा? आई एम टेलिंग यू इन अ वेरी कॉन्सेप्चुअल मैनर माय डियर फ्रेंड्स. एम्ब्रियोलॉजी का नाम सुनते ही बहुत सारे स्टूडेंट्स एक्चुअली क्या होते हैं ना, दे विल बी हैविंग अ फोबिया, और योर एम्ब्रियोलॉजी बहुत डिफिकल्ट इन ऑल. बट एग्जैक्टली कॉन्ट्ररी टू दैट, ऑपोजिट टू दैट, आई एम टेलिंग यू, एम्ब्रियोलॉजी इज एक्चुअली वेरी कॉन्सेप्चुअल. इट्स ऑल अबाउट अंडरस्टैंडिंग इन दैट मैनर, अप्रोचिंग द टॉपिक इन दैट मैनर. तो उसी तरीके से मैं आपको यहाँ पर बता रहा हूँ. आई एम टेलिंग यू इन द सेम मैनर हियर माय डियर फ्रेंड्स, तो प्लीज फॉलो. ओके, नाउ इंट्रा एम्ब्रियोनिक सीलोम क्या फॉर्म करेगा? थोड़ा कॉमन सेंस लगाओ ना, अप्लाई अ लिटिल बिट कॉमन सेंस. इंट्रा एम्ब्रियोनिक सीलोम, सीलोम मीन्स कैविटी. इट इज गोइंग टू फॉर्म व्हाट? इट शुड फॉर्म द कैविटीज प्रेजेंट इनसाइड अवर बॉडी. कम ऑन डॉक्टर, थोड़ा सोचिए. डोंट वेट देयर फॉर मी कि अच्छा हम सर हमको बताएंगे, हम इसको नोट डाउन कर लेंगे, बाद में रट्टा मारेंगे. प्लीज़ चेंज दैट कन्वेंशनल मेथड ऑफ स्टडिंग. वो स्कूल डेज वाला मेथड आप यहाँ पर छोड़ दीजिए अभी ना, कि सर बताएंगे, हम नोट्स में लिखेंगे, क्लास के बाद में रट्टा मारेंगे. ट्राई टू थिंक अबाउट दैट वन. इंट्रा एम्ब्रियोनिक सीलोम मतलब जो एम्ब्रियो के अंदर है, एंड इट हैज़ टू फॉर्म द कैविटीज प्रेजेंट इनसाइड आवर बॉडी. नाउ टेल मी, इनसाइड योर बॉडी एंड माई बॉडी, सराउंड इन द पेरिकार्डियम, pericardial cavity, surrounding the lungs, pleural cavity, and then in the abdominal organs surrounding that viscera, you'll be having peritoneal cavity. तो हमारी बॉडी के अंदर जो मेनली जो कैविटी, यस डॉक्टर अनिश, वेरी नाइस। तो पेरिकार्डियल कैविटी, प्लूरल कैविटी एंड पेरिटोनियल कैविटी, ये कैविटीज कहाँ से फॉर्म होनी चाहिए? दे शुड बी डिराइव फ्रॉम वेयर? ऑफ कोर्स इंट्रा एम्ब्रियोनिक सीलोम। तो इंट्रा एम्ब्रियोनिक सीलोम, इट इज द वन विच इज गोइंग टू फॉर्म ऑल द कैविटीज प्रेजेंट इनसाइड द बॉडी। नाम में ही लिखा है इंट्रा एम्ब्रियोनिक सीलोम। ओके, सो इट इज गोइंग टू फॉर्म द प्लूरल, then it is going to form the pericardial and peritoneal cavity, and it is going to form peritoneal cavity. That's all. Already this was even asked in the NEET PG exam also. So these cavities are derived from where? And the answer is intra-embryonic coelom is going to form that. No need to mug up also. नाम में लिखा है intra-embryonic coelom अपने बॉडी के अंदर की cavities form करेगा. Now right from school days, I think you have learned in your 11th and 12th standard also that all these cavities are surrounded by two layers. Outer one will be parietal, inner one will be visceral. है ना? For example, like pleura has got like two layers, parietal pleura, visceral pleura. Peritoneum has got like two layers, parietal peritoneum, visceral peritoneum. Now you apply common sense and tell me, parietal layer, the outer one, which is along with the body wall, they should be derived from where? All the parietal layers should be derived from the somatopleuric lateral plate mesoderm. All the parietal, I'm just writing in general as parietal layers. Wow. Are you observing there how the topic is becoming easy for you now? So parietal peritoneum, parietal pericardium, and then parietal pleura, everything, all the parietal layers are derived from somatopleuric क्योंकि वो outer है, body wall के साथ में है, ectoderm के साथ में. And then all the visceral layers are derived from splanchnic lateral plate mesoderm. So visceral pleura, visceral pericardium, the visceral peritoneum, all these are derived from the splanchnic lateral plate mesoderm. So, crystal clear concept. Okay, itna आसान है. Now, once you are done with this one, don't forget our planning here. I told you very clearly, all these structures are derived from paraxial mesoderm, from the somites, and whatever is left out, you have to be derived from, it has to be derived from lateral plate mesoderm. Now we are learning about what? Lateral plate mesoderm here. So please write down here one by one. चलिए देखते हैं. Apply common sense here. I don't have to teach you anything here. Just apply common sense here, my dear friends. Yes, come on. Dermis of the back is derived from paraxial mesoderm. So dermis of the front of the body should be derived from lateral plate. Fine. But now what is the panga? The panga is we are having two types of lateral plate mesoderm. One is somatopleuric and splanchnic. From that time I'm continuously teaching you here. Let me test whether you people are with me or not. अब आप मुझे बताइए डर्मिस, जैसे मैंने आपको बोला है ना सोचने का तरीका, हाउ शुड यू थिंक. तो डर्मिस वाला अगर पार्ट है तो इट शुड बी डिराइव फ्रॉम सोमैटोप्ल्यूरिक और स्प्लैंक्टोप्ल्यूरिक. Dermis of the front of the body, it should be derived from somatopleuric or splanchnopluric. Lovely, that's really nice. It should be derived from somatopleuric. How are you able to tell that one? Very good, very nice. How are you able to say that one? देखो मैं पढ़ाने से पहले, बिफोर आई एम टीचिंग यू इटसेल्फ, यू आर एबल टू आंसर दैट टू इन एम्ब्रियोलॉजी, ठीक है ना. सो एम्ब्रियोलॉजी बड़ा आसान है सर, बिकॉज इट इज अलॉन्ग विद द बॉडी. हाँ बाहर है, वेरी नाइस. सो इट इज गोइंग टू फॉर्म द डर्मिस, एंड दैट टू डर्मिस ऑफ फ्रंट ऑफ द बॉडी. चलो डन. Then next is, we are done with the dermis. The next is axial skeleton. Axial skeleton is derived from paraxial mesoderm, somites. Now what is left out? Appendicular skeleton, and that appendicular skeleton will also be derived from somatopleuric. मतलब आपके अपर लिम और लोअर लिम में जो बोन्स है appendicular skeleton कहते हैं, और ये कहाँ से फॉर्म होते हैं? They are formed from somatopleuric lateral plate mesoderm. सोमैटोप्ल्यूरिक लेटरल प्लेट मेसोडर्म. ये हो गया. कैविटी तो हमने ऑलरेडी फिनिश कर दिया था यहाँ पर. फाइन. नाउ व्हाट अबाउट द मसल्स हियर? स्केलेटल मसल ऑलरेडी डन, स्मूथ मसल एंड कार्डियक मसल. अब मसल्स कहाँ पर? दे आर अ पार्ट ऑफ विसरा और द बॉडी वॉल. दे आर पार्ट ऑफ द विसरा ओनली. तो देयरफॉर visceral one, the splanchnopluric one, it will be forming the smooth muscles, and also it is going to form your cardiac muscles. So smooth muscles and cardiac muscles are derived from splanchnopluric lateral plate mesoderm. Splanchnopluric lateral plate mesoderm. Okay. So my dear doctors, today I have made you perfect here with the derivatives of the mesoderm in a very, very conceptual manner. We have learned all the mesoderm. Mesoderm से क्या क्या फॉर्म होता है बड़े कॉन्सेप्चुअल मैनर से हमने यहाँ सीख लिया है। तो अगर आज से आपको पूछेगा कोई, इफ समवन आस्क यू ह्यूमरस बोन इज डिराइव फ्रॉम वेयर, ह्यूमरस बोन कहाँ से फॉर्म होती है, तो थोड़ा सा दिमाग लगाइए, ह्यूमरस बिलोंग्स टू विच वन, एपेंडिकुलर स्केलेटन, एंड एपेंडिकुलर स्केलेटन मीन्स इट शुड बी डिराइव फ्रॉम सोमैटोप्ल्यूरिक लेटरल प्लेट मेसोडर्म। आंसर करिए, इट इज लाइक परफेक्ट वन। Tibia and fibula are derived from where? Tibia and fibula belong to appendicular skeleton. They'll be derived from somatopleuric. अच्छा, later on मैं आपको बार बार याद करवा रहा हूँ. I'm telling you like again and again. First week, second week and third week of development. जनरल एम्ब्रियोलॉजी, फिर यहाँ से स्टार्ट होता है सिस्टमिक एम्ब्रियोलॉजी. लेटर ऑन हम पढ़ेंगे इन सिस्टमिक एम्ब्रियोलॉजी सीवीएस एम्ब्रियोलॉजी, कार्डियोवास्कुलर सिस्टम एम्ब्रियोलॉजी मैं आपको पढ़ाऊंगा. इन दैट सीवीएस एम्ब्रियोलॉजी वी आर गोइंग टू लर्न अबाउट डेवलपमेंट ऑफ हार्ट. एंड तब आप मुझे बताओगे, यू आर गोइंग टू टेल मी कि हार्ट विल बी डिराइव फ्रॉम वेयर. हार्ट, कम ऑन, कार्डियक मसल्स, come on my dear doctors, the cardiac muscles, heart will be derived from where? Splanchnopluric lateral plate disorder. Not only in my class I'm telling you, even in your university, in your college, wherever you are studying, if your professors are asking you कि heart will be derived from where, tell them confidently splanchnopluric lateral plate mesoderm. खत्म कहानी, खत्म कहानी. Understanding your point here, sir? So in this manner, you can answer from me. Smooth muscles are derived from where? Smooth muscles are derived from where? Splanchnopluric. Now I'll tell you one question that was asked in PG exams. See, that is the advantage of our Prof Ed's classes over here. Slowly we are going to give you the orientation of the PG also from here. अब PG एग्जाम में कैसे पूछा गया था पता है आपको? सुनिए ध्यान से, कैसे अप्लाई करना है. आपको पता है कि वॉल ऑफ द आर्टरी में कितने लेयर होते हैं? हाउ मेनी लेयर्स आर देयर इन द वॉल ऑफ द आर्टरी? हाउ मेनी लेयर्स डू यू हैव इन द वॉल ऑफ द आर्टरी? Come on. Yes, there are 3 layers. Okay. ट्यूनिका एक्सटर्ना, ट्यूनिका इंटीमा एंड ट्यूनिका मीडिया करके आपने कहीं ना कहीं तो सुना होगा. एंड यहां से अगर मैं आपको सवाल करूंगा, इफ आई आस्क यू वन क्वेश्चन हियर कि ट्यूनिका मीडिया इज डिराइव फ्रॉम वेयर? ट्यूनिका मीडिया विल बी डिराइव फ्रॉम वेयर? लुक एट द वे हाउ वी हैव अप्लाई द कॉन्सेप्ट. ट्यूनिका मीडिया विल बी डिराइव फ्रॉम वेयर? Yes. Splanchnopluric. Very nice. That's really nice. That's really nice. Okay. Splanchnopluric. Yes. Lateral plate mesoderm से form होता है. How can you tell, Dr. Anish? How can you tell it is derived from splanchnopluric? Why? Because tunica media in the artery is made up of smooth muscle fibers. तभी तो आर्टरीज कॉन्ट्रैक्ट और रिलैक्स होते हैं. वेजो कंस्ट्रिक्शन एंड वेजो डायलेटेशन होता है. तो वेजो कंस्ट्रिक्शन, वेजो डायलेटेशन जो होता है वो दो स्मूथ मसल से होता है. तो स्मूथ मसल कौन से फॉर्म होते हैं? स्प्लैंक्नोप्ल्यूरिक. आर यू अंडरस्टैंडिंग? तो इसीलिए मैंने आपको जो आज पढ़ाया है ना, इट्स नॉट लाइक आई एम जस्ट गिविंग यू ए लिस्ट हियर. अगर आप ना आपके टेक्स्ट बुक में देखोगे, इट विल बी रिटन लाइक अ लिस्ट कि दिस इज डिराइव फ्रॉम हियर, दिस इज डिराइव फ्रॉम हियर. पता नहीं, एक लंबा सा लिस्ट होता है. वो लिस्ट देखते ही आप बोलोगे कि भाई क्लोज द बुक, एम्ब्रियोलॉजी डिफिकल्ट है. तो मैं आपको लिस्ट नहीं दे रहा हूँ, आई एम टीचिंग यू द कॉन्सेप्ट. मैं सिखा रहा हूँ कि सीखते कैसे हैं. अब यहाँ से आप अप्लाई करते जाओ, कीप ऑन अप्लाइंग हियर. जहाँ जहाँ स्मूथ मसल है स्प्लैंक्नोप्ल्यूरिक, कार्डियक मसल है स्प्लैंक्नोप्ल्यूरिक, अगर स्केलेटल मसल्स है सोमैटोप्ल्यूरिक से फॉर्म. समझ रहे? सॉरी, स्केलेटल मसल्स अगर होगा तो पैराक्सियल मेसोडर्म से फॉर्म होगा. तो इन दिस मैनर आई टोल्ड यू द बेसिक कॉन्सेप्ट हियर. आर यू अंडरस्टैंडिंग माई इंटेंशन हियर? आर यू अंडरस्टैंडिंग माई क्लैरिटी हियर? एंड दैट टू हार्डली इन फ्यू मिनट्स वी आर डन विद दिस वन हियर. तो अगर आप ये डायग्राम याद रखोगे, इफ यू रिमेंबर दिस डायग्राम हियर, दैट्स ऑल सर. कीप ऑन प्लेइंग विद दैट वन. जो भी पूछा जाएगा एग्जाम में आंसर करते जाइए. तो मेसोडर्म वाला पार्ट यहाँ पर हो गया सर. आर यू क्लियर विद दिस वन हियर? Come on, my dear friends, are you done? चलिए. Now once you have understood this part here, sir, we are done with mesoderm. यहाँ planning देखिए sir, try to understand the planning here. We are done with this mesoderm वाला part here, paraxial, intermediate and lateral plate. Now I will tell you one thing in depth, right? थोड़ा ध्यान से सुनिए sir. Now I told you lateral plate mesoderm. In this diagram, this is the last topic, sir. Last topic. No. स्मॉल इंटेस्टाइन स्प्लैंक्नोप्ल्यूरिक से नहीं है. देखो, यू आर टेकिंग मी रॉन्गली. मैंने आपको कहा कि स्प्लैंक्नोप्ल्यूरिक लेटरल प्लेट मेसोडर्म विसरा के पास में होता है. विसरा के पास में होता है मतलब इसीलिए तो उसका नाम क्या है? स्प्लैंक्नोप्ल्यूरिक है. ठीक है ना. और ये रेड कलर्ड वाला जो लाइन है वो क्या है? एंडोडर्म है. तो वो एंडोडर्म के पास में है तो वो स्प्लैंक्नोप्लूरिक फॉर्म करते हैं। अब आप ये मत समझो कि सर इसी से ही इंटेस्टाइन फॉर्म होता है, ना 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 ना। intestines and all those, in general the entire gut, foregut, midgut, hindgut, the entire gut will be derived from endoderm, वो endoderm से फॉर्म होता है और ये एंडोडर्म के पास में है, मतलब इंटेस्टाइन्स के पास में है, विसरल ऑर्गन्स के पास में है, इसीलिए उसका नाम क्या है, स्प्लैंक्नो है। इसी से विसरल ऑर्गन फॉर्म नहीं होते हैं। तो विसरल ऑर्गन्स कहाँ से फॉर्म हो रहे हैं आपके, एंडोडर्म से। जो गट है, गट कहाँ से फॉर्म होगा, जो आपने सवाल पूछा मुझे, वो फॉर्म होता है एंडोडर्म से। तो वो मैं आपको पढ़ाऊंगा कहाँ पर, सिस्टमिक एम्ब्रियोलॉजी में, ठीक है ना। विल बी लर्निंग अबाउट गट, गट वे बहुत इंपॉर्टेंट टॉपिक है। डेवलपमेंट ऑफ लिवर, डेवलपमेंट ऑफ द स्प्लीन, पैंक्रियास, स्मॉल इंटेस्टाइन, मिड गट, रोटेशन ऑफ गट, बहुत इंपॉर्टेंट कॉन्सेप्ट्स है, वो हम पढ़ेंगे, ठीक है ना। तो वो एंडोडर्म से आता है। आई होप योर डाउट इज क्लैरिफाइड। नेक्स्ट वन, नाउ द लास्ट एंड फाइनल थिंग दैट इज लेफ्ट आउट राइट नाउ, थोड़ा ध्यान से सुनना सर, थोड़ा ध्यान से सुनना। Lateral plate mesoderm we divide to two parts here, somato and splanchno. Good. But there is a part where it is not differentiated. This part is not differentiated into somato or splanchno here. So therefore, my dear friend, this undifferentiated lateral plate mesoderm is referred to as septum transversum. This is going to come as a very short note. इसको हम कहते हैं सेप्टम ट्रांसवर्सम, extremely important. So the first thing is, what is septum transversum? Study in a simple manner. It is undifferentiated lateral plate mesoderm. Simple. If anyone is asking you what is septum transversum, it is undifferentiated lateral plate mesoderm. Lateral plate mesoderm is divided into somatopleuric and splanchnopluric. The one which is along with the ectoderm, somatopleuric. The one which is along with the endoderm, it is splanchnopluric, fine. But the undifferentiated part is referred to as septum transversum. Septum transversum. And now, my dear friends, what are the derivatives of this one? यही तो आपको आपके यूनिवर्सिटी एग्जाम्स में एज ए वेरी शॉर्ट क्वेश्चन आ सकता है या फिर वाइवा में भी पूछा जा सकता है। नाउ व्हाट आर द डेरिवेटिव, देयर आर लाइक 4 डेरिवेटिव्स ऑफ दिस वन। आप सुनिए सर, ऊट पटांग। लाइक नंबर 1, septum transversum is the one which is going to form central tendon of diaphragm. Look at the list now, there are like 4 things forming from here. Central tendon of diaphragm. Number 2, it is the one which is going to form the fibrous pericardium, the outermost layer of the pericardium, that is fibrous pericardium. Number 3, it is the one which is actually going to form the stroma of liver. And number 4, it is going to form the ventral mesentery of stomach. ठीक है, या फिर इसी को आपके बुक्स में लिखा जाता है वेंट्रल मीजोगैस्ट्रियम, स्टमक गैस्ट्रियम, ठीक है। Now please look at this list here, sir. Why I'm telling you like oot patang list here? Why? Because number 1, diaphragm. Number 2, pericardium. Number 3, liver. And number 3, your stomach. Mesentery, basically. The mesentery of the stomach. 4 different things. 4 different things. Sir, how to remember this one here? I'll tell you. The simplest way to remember this one is, remember, septum transversum you apply on your body. So wherever you're sitting and listening to me right now, my dear friends, you apply this one on your body, it is going to form this part here, this part. So first of all, it is going to form the central tendon of diaphragm. I hope you're able to see me. The central tendon of diaphragm. और बिल्कुल इसके ऊपर यहाँ पर हार्ट होता है. Heart is surrounded by pericardium. तो remember fibrous pericardium. Then on the right side liver, stroma of the liver. Then on the left side stomach, the ventral mesentery of the stomach. तो ऐसे याद रख लो. That is the only way to remember. Central tendon of diaphragm, and then fibrous pericardium, then the stroma of the liver and the ventral mesentery of the stomach. That's all done. तभी क्लास में ही याद हो जाएगा. So what is septum transversum? Septum transversum is nothing but undifferentiated lateral plate mesoderm. And that undifferentiated lateral plate mesoderm is going to form 4 structures. Let us repeat together again. Come on, you also try to repeat along with me. Number 1, central tendon of diaphragm. Number 2, fibrous pericardium. Number 3, the stroma of the liver. And number 4, the ventral mesentery of the stomach. Done. ओके, सो इन दिस मैनर यहीं पर एक शॉर्ट क्वेश्चन आपको याद हो जाएगा. ओके, तो बाय दिस, wow, look at the sequencing there, look at the arrangement of the topics there. Slowly we have gone in depth and completed this one, sir. ओके, तो मीसोडर्म वाला पार्ट आज हमारा ये कंप्लीट हो चुका है. दिस इज कंप्लीटेड हियर. आर यू गेटिंग द क्लैरिटी माय डियर फ्रेंड्स? Come on, are you all done with the copying work? I think it is done. Now once you are done with this one here, let us go ahead with the further thing. I told you in this diagram we are done with what here? Mesoderm in depth complete हो गया sir. We are done in depth. Now welcome to the middle part. अब ये नोटोकॉर्ड से ना न्यूरल ट्यूब कैसे फॉर्म हो रहा है? मीसेंट्री का मतलब क्या होता है? हाँ, मीसेंट्री का मतलब क्या होता है? डबल लेयर ऑफ पेरिटोनियम. नथिंग न्यू स्ट्रक्चर, नथिंग न्यू स्ट्रक्चर. मैं आपको एक इन जनरल एक सिंपल सा डायग्राम ड्रॉ करता हूँ. मान लो कि ये आपका बॉडी वॉल है. आई एम जस्ट ड्रॉइंग अ स्कीमेटिक डायग्राम. मान लो कि बॉडी वॉल है. मान लो कि ये कुछ विसरल ऑर्गन है, सम ऑर्गन लाइक योर गट. So for example, if this one is your body wall, outer body wall, I'm taking a transverse section. Okay, then this one here will be your gut, inside esophagus, stomach वगैरह. Now आप मुझे help करिए, you help me right now. The peritoneum which is covering the organ will be, the peritoneum covering the organ will be visceral peritoneum. The inner wala is visceral peritoneum, and the outer one which is along with the body wall here will be parietal peritoneum. What is that one? That is parietal peritoneum. ये तो हम लोग स्कूल डेज से पढ़ रहे हैं. देयर आर टू लेयर्स इन पेरिटोनियम, इनर वन विसरल, आउटर वन पेराइटल. ये तो हमको पता है. नाउ दीज टू, वेलकम टू एमबीबीएस नाउ. नाउ दीज टू आर कनेक्टेड बाय डबल लेयर ऑफ पेरिटोनियम. दे आर कनेक्टेड बाय डबल लेयर ऑफ पेरिटोनियम, एंड दिस डबल लेयर ऑफ पेरिटोनियम हियर इज नोन एज मीसेंट्री. इसी को मीसेंट्री कहते हैं. दैट्स ऑल. वेरी गुड. आई एम लाइक रियली हैप्पी दैट यू आर आस्किंग मी दिस डाउट्स हियर, because in the first year MBBS, yes, you should be like very clear with the concepts. अच्छा हुआ कि आपने मुझे पूछ लिया. Ask me whatever you want to ask me, sir. Don't shy in the class here. I'll answer you. So what is mesentery from today onwards? Remember, it's nothing new structure. कोई नया वाला structure नहीं है. Just double layer of peritoneum. Double layer of peritoneum connecting the parietal with the visceral. Peritoneum ही है. Peritoneum ही है. Double layer of peritoneum connecting the parietal with the visceral. उसी को mesentery. अब मान लो, यहां देखो, थोड़ा सा मैं आपको इन डेप्थ बताता हूं. अब मान लो कि यहां पर सेंटर में ये स्टमक है. स्टमक है, तो स्टमक के आगे पीछे जो मीसेंट्री होगा, मीसोगैस्ट्रियम. अब मान लो दैट डबल लेयर ऑफ पेरिटोनियम इज कनेक्टिंग योर कोलॉन. अब आपको पता है ना ट्रांसवर्स कोलॉन. कभी आपने सोचा है कि ये ट्रांसवर्स कोलॉन यहां से नीचे क्यों नहीं आता है? इसका ड्यू टू ग्रेविटी. असेंडिंग कोलॉन, ट्रांसवर्स कोलॉन, डिसेंडिंग कोलॉन हम पढ़ते हैं, लेकिन सर ये ट्रांसवर्स कोलॉन नीचे गिर क्यों नहीं रहा है? व्हाई इट इज नॉट फॉलिंग डाउन? ड्यू टू ग्रेविटी. तो प्लीज रिमेंबर, पेरिटोनियम विल कम हियर, enclose that colon and go back, and there is a double layer of peritoneum holding that colon. डबल लेयर ऑफ पेरिटोनियम उसको ऐसे होल्ड करता है पीछे से. ओके, और उसको हम क्या कहेंगे फिर से इन जनरल? मीसेंट्री. और क्योंकि वो कोलॉन को होल्ड कर रहा है इसीलिए उसको कहते हैं मीसोकोलॉन. वैसे ही अपेंडिक्स को होल्ड करने के लिए मीसो अपेंडिक्स. वैसे ही स्टमक के लिए मीजोगैस्ट्रियम. ओवरीज के लिए मीजो ओवेरियम होता है. तो आज से फ्रॉम टुडे ऑनवर्ड्स ऑल माय स्टूडेंट लिसनिंग टू मी राइट नाउ, दिस कॉन्सेप्ट इज वेरी क्लियर नाउ. आज से अगर आप सुनोगे मीसो अपेंडिक्स, मीसो ओवेरियम, मीसो गैस्ट्रियम, मीसो कोलॉन, don't worry, it's all nothing but mesentery. And what is mesentery? Double layer of peritoneum. खत्म. अंडरस्टैंडिंग में पॉइंट ही इतना सिंपल है. ठीक है, तो जहां जहां पर भी आप ये सुनोगे ना मीसो मीसो करके, नथिंग बट मीसेंट्री, डबल लेयर ऑफ पेरिटोनियम. चलिए आगे बढ़ते हैं सर. अब हम देखेंगे सेंटर वाला पार्ट. हमने मीसोडर्म तो बहुत डिटेल में पढ़ लिया है अभी. अब हम देखेंगे सेंटर वाला पार्ट कि नोटोकॉर्ड न्यूरल ट्यूब कैसे फॉर्म करता है. तो जैसे मैंने आपको कहा था माय डियर डॉक्टर्स, हेलो, after completing the first week, second week and third week of embryology, general embryology will be done, and from there begins your systemic embryology. Systemic embryology यहाँ से start होता है. ओके, तो हम स्टार्ट करते हैं पहला सिस्टम. द फर्स्ट सिस्टम दैट वी आर गोइंग टू बिगिन राइट नाउ इज योर सेंट्रल नर्वस सिस्टम एम्ब्रियोलॉजी. ओके, CNS एम्ब्रियोलॉजी, सेंट्रल नर्वस सिस्टम एम्ब्रियोलॉजी. फाइन. In CNS embryology, you have to learn about neurulation. What do you mean by neurulation? Neurulation means formation of neural tube. Please listen to this very, very carefully right now. Formation of neural tube, my dear friends. Okay. न्यूरल ट्यूब फॉर्मेशन को हम कहते हैं न्यूरुलेशन. ओके, ये बहुत इंपॉर्टेंट क्वेश्चन है, ध्यान से सुनना. अब ये न्यूरल ट्यूब फॉर्मेशन कब बिगिन होता है? यस, इट बिगिंस इन 3rd वीक ओनली. अच्छा, दैट इज द रीजन व्हाई वी आर लर्निंग इट राइट नाउ. आर यू अंडरस्टैंडिंग माय डियर फ्रेंड्स? तो 3rd वीक से ही बिगिन होता है, तो वहीं से हम कंटिन्यू करते हैं. तो न्यूरल ट्यूब फॉर्मेशन बिगिंस इन विच वीक माय डियर फ्रेंड्स? इन द 3rd वीक. अब आप अगर ये डायग्राम देखोगे ना, टेक्स्ट बुक वाला डायग्राम एंड ऑल, यू विल गो मैड, व्हाट द हेल इज हैपनिंग. फर्स्ट आई विल गिव यू माय सिंपल डायग्राम्स देयर, देन अगेन विल कम बैक टू दिस वन. ओके, फिर हम बाद में रिफर करेंगे इसको. सो नाउ माय डियर फ्रेंड्स, वेलकम हियर. अब फॉर एग्जांपल आई एम यूजिंग द सेम कलर्स अगेन. दिस इज योर ectoderm here, this one is your endoderm here, in the middle you are having mesoderm, and then this one here will be the notochord. If you want, we'll write it once more here. This one is ectoderm here, this one is endoderm here, and this one is mesoderm. Please write down the heading in your notebooks. We are learning right now CNS embryology, and in CNS embryology we are learning which topic right now? We are learning neurulation. Suniye sir, hardly in 10 minutes how this will be completed. Okay, now whatever this notochord is present over here, ये जो notochord है ना, this notochord is going to induce the overlying ectoderm. ये ectoderm को induce, stimulate करता है. Once it is going to induce that overlying ectoderm, जैसे वो ectoderm को induce करता है, now there will be certain changes here. This ectoderm is going to become like this here. This one is your notochord. Fine, I'm using the same colors, so there is no confusion there. Now जैसे वो उसको induce करता है ना notochord, the moment this notochord is going to stimulate this ectoderm, first of all this is going to become like a plate, और इस plate को हम कहते हैं neural plate. This is neural plate. It is going to become like a plate, neural plate. If you observe the ends of this neural plate here, there will be folds, and this one here will be the neural folds. Neural folds कहते हैं सर, ठीक है ना? And those neural folds, you are able to see the neural fold on both the side here. So there is a neural fold here also, and there is a neural fold here also, and those two neural folds are coming closer, coming closer. Now because these two are coming closer here, in the middle there is a formation of groove here, and this groove here will be referred to as neural groove. That is neural groove there. So there will be neural plate, and the ends will be neural folds, and they're coming closer, and in the middle there is a groove form, neural groove. Itna आसान है. So unnecessarily our students will be like, seeing all these names, they'll be getting confused there. अरे यार इतने सारे नेम हमको क्या याद रखना है यार, सब टाइम पास है. तो पहले यहाँ पर जो प्लेट होती है उसको न्यूरल प्लेट कहेंगे, और न्यूरल प्लेट के एंड में जो फोल्ड्स होते हैं उसको न्यूरल फोल्ड्स कहेंगे, और फिर वो करीब में आते हैं तो इसलिए यहाँ पर ग्रूव फॉर्म होता है, न्यूरल ग्रूव कहेंगे. And now one fine day what is going to happen? One fine day they are not going to stop here only, sir. They'll come closer, they'll come closer, they'll come closer and fuse together. And once they fuse together, again the ectoderm will be like this only. There's no problem with the ectoderm there. वो फ्यूज हो जाता है, लेकिन वहां से हमने एक ट्यूब यहाँ पर निकाल दिया है. Are you understanding me? And this one here is your notochord again. Sorry, this one here will be the notochord again here, sir, and then this one here is your endoderm. Wow. अब यहाँ पर ये जो ट्यूब फॉर्म होता है, वट एवर ट्यूब लाइक स्ट्रक्चर इज फॉर्म्ड हियर, दिस ट्यूब इज रिफर्ड टू एज योर न्यूरल ट्यूब. दैट्स ऑल, दैट्स ऑल. उसी को न्यूरल ट्यूब कहते हैं. Are you understanding me here? So just in 3 diagrams we are done with the formation of neural tube here, and in fact you can draw these diagrams in your exams. You will get marks like nothing. Okay, आप अपने एग्जाम्स में, फाइनल एग्जाम्स में से डायग्राम ड्रॉ कर सकते हो. बस वो अगर डायग्राम ही देख लेगा ना, आपका एग्जामिनर जो करेक्शन करेगा, अगर ये डायग्राम ही देख लेगा तो उसको समझ में आ जाएगा कि बंदे को कॉन्सेप्ट पता है. ही विल नॉट इवन रीड द टेक्स्ट. उसके बाद में आप अंग्रेजी में ना लिखते जाइए आंसर, ठीक है ना? तो प्लीज़ लर्न द डायग्राम्स वेरी केयरफुली इन एनाटॉमी. बस उसी को आपको क्या करना होगा, नोट्स में यू हैव टू जस्ट राइट इन इंग्लिश, फिल दैट वन. आर यू अंडरस्टैंडिंग मी? So let us repeat this again. The notochord is going to stimulate the overlying ectoderm, and then it is going to become like a plate here, that is neural plate, and then the ends will be like folds here, sir. That is nothing but neural folds, and then because the neural folds are coming closer, it is going to form a groove here. And then what is going to happen, my dear friend, जैसे ये फ्यूज हो जाएगा ना, yes, डॉक्टर राजेश, जैसे यहाँ पर ये फ्यूज हो जाएगा, the moment it is going to fuse together, then it is going to become like a tube here, and इसी tube को हम कहते हैं neural tube here. Did you understand this last diagram right now? Come on, my dear doctors. Did you understand that last diagram? Perfect. Okay. Now try to understand here in 3D, my dear friends. इसको ना थोड़ा सा ना 3 डायमेंशन में समझने की कोशिश करिए. I'll show you how. Look here. I'll show you here. Now you imagine this paper here, this one here, to be your ectoderm. In our diagram here, we are drawing the ectoderm like a line here, sir. That blue colored line. That blue colored line we are drawing there. It is not like a line. Understand in 3D. Yes. Understand in 3D right now. This layer, ये line की तरह नहीं है. Layer है, ectoderm layer है. And that ectoderm here, just below that you'll be having your mesoderm and the endoderm there. In the mesoderm, मान लो my pen here is like notochord here. This is like notochord. Now this notochord is going to induce the ectoderm. It is going to stimulate करेगा. So that is why it is going to become like a plate here. That plate is known as neural plate. Are you understanding me? तभी तो उसका नाम क्या दिया गया है? Neural plate करके दिया गया. It is becoming like a plate. And the ends of the neural plate will now start folding. And this ends here. These folds are known as neural folds. And these neural folds are coming closer. They're coming closer. So there is a formation of groove here. यहाँ पर एक groove form हो रहा है. इसीलिए इसको कहते हैं neural groove कहते हैं. And then what will happen? They'll come closer, and they will fuse. And once they fuse here together, it is going to become like a tube, and that is nothing but neural tube. Come on, are you understanding now? That's how the neural tube will be formed here, sir. Are you getting me? So now, my dear friends, this neural tube is the one which we are seeing in which section here? This we are actually seeing in transverse section. Transverse section here. Excellent concept here. तो न्यूरल ट्यूब वी आर सीइंग इन विच सेक्शन? ट्रांसवर्स. अब इसी को थोड़ा सा हम ऐसे कर देते हैं तो इट इज गोइंग टू बिकम व्हाट सर? यस, वर्टिकल न्यूरल ट्यूब लाइक स्ट्रक्चर. अब ये ट्यूब में ना 2 ओपनिंग्स होते हैं यहाँ पर. देयर हैविंग 2 ओपनिंग्स देयर. वन ओपनिंग अबव एंड वन ओपनिंग बिलो. नाम में ही लिखा है यार. इट इज देयर इन द नेम इटसेल्फ. इट इज अ ट्यूब. तो ट्यूब में 2 ओपनिंग तो होंगे ना. तो देयर विल बी क्रेनियल न्यूरोपोर. PORE, पोर कहते हैं. क्रेनियल न्यूरोपोर एंड द कॉर्डल न्यूरोपोर. क्रेनियल एंड कॉर्डल न्यूरोपोर. ओके. सो दिस इज एक्चुअल डायग्राम ऑफ न्यूरल ट्यूब सर. न्यूरल ट्यूब का एक्चुअल डायग्राम ऐसे होता है. ठीक है ना. दैट इज द न्यूरल ट्यूब. और इसमें जो ऊपर वाला ओपनिंग है, ये वाला जो ओपनिंग है, दिस इज न्यूरोपोर, क्रेनियल और एंटीरियर न्यूरोपोर. और ये जो नीचे वाला जो ओपनिंग है, दिस ओपनिंग बिलो इज पोस्टीरियर और कॉर्डल न्यूरोपोर है. Now remember one thing, my dear friends. Our neural tube is the one which is going to form the central nervous system. So what is derived from neural tube? Central nervous system. What is included in the central nervous system? It will include your brain as well as the spinal cord. Brain and the spinal cord. Okay. That means इसका जो ऊपर वाला जो part है, it is going to form your brain here. और जो नीचे वाला part है, it is going to form the spinal cord here. So upper part is going to form the brain and the lower part is going to form the spinal cord. Now अब आप मुझे ये बताइए, मान लो I am an embryo. This is the neural tube present over here. Neural tube is going to form my brain and the spinal cord. My brain and the spinal cord. Fine. Brain and the spinal cord. अब इसमें यहाँ पर opening है, यहाँ पर opening है during development. Now compare this embryology with gross anatomy, with our body right now, with your body and my body right now, sir. So compare the embryology with our body right now. Do we have any opening in the brain here? No. Do we have any opening in the spinal cord here? No. तो क्या होना चाहिए? What should happen? It should be closed. It should be closed. Yes, ये close हो जाता है. ठीक है ना. अब आपको याद रखना होगा, my dear doctors, कि ये कब close होता है. When is this going to get closed? So remember, the cranial neuropore will close on 25th day, whereas the caudal neuropore will close on 28th day of the pregnancy. Oh my God. 25th day को ये close होता है और 28th day को caudal neuropore close होता है sir. Is it okay? Fine here. So now let us draw this diagram in our simple manner. चलिए, तो ये वाला डायग्राम जो आपको नजर आ रहा है ट्रांसवर्स सेक्शन में है. कंटिन्यू कीजिए मेरे साथ में. कंटिन्यू द डायग्राम अलोंग विथ मी. Let's make this neural tube vertical right now. This is like our diagram, sir. तो मान लो कि this one will be the neural tube here. If this is neural tube here, what are the derivatives of the neural tube, sir? What is derived from the neural tube? Number one, it is the one which is going to form central nervous system. Central nervous system will be including your brain as well as the spinal cord. So the cranial part, upper part is going to form brain and the caudal part is going to form spinal cord. And even it is going to form all the glial cells also, the supporting cells. आपने पढ़ा होगा in your school days. Oligodendrocytes, microglial cell, astrocytes, all the supporting cells also are derived from here only. Okay, except the Schwann cells. Schwann cells तो अलग form होता है neural crest cells से. Fine. So it is going to form your brain spinal cord. Now because this is a tube-like structure, there will be a opening here and then there will be one more opening here. And this one will be referred to as your anterior or the cranial neuropore, and this one will be the posterior or the caudal neuropore. So this one will be referred to as neuropore cell. Now normally what should happen in the normal people like you and me, the cranial neuropore normally closes on 25th day. I'm just writing that as D25. That means it is 25th day. Don't take it wrongly like a week or month or something like that. 25th day. Whereas the caudal neuropore will be closing. Normally it closes on 27th or 28th day. अगर आपको दोनों में से ना बेटर ऑप्शन चाहिए तो बेटर ऑप्शन विल बी 28th day. 27th to 28th day क्लोज होता है. ठीक है ना? That's how your normal neural tube will be formed there. Okay, इतना आसान है. Hardly in 10 minutes it is done, sir. So that is what is going to form your brain and spinal cord. Now all my dear doctors, listen to me very carefully here. One important take home point from today. See, it's not about just learning. Actually ना जो अभी आप MBBS कर रहे हो, मेडिसिन कर रहे हो, you are in your first year right now. It's not just learning for the sake of exams and learning for the sake of question and answer for the exam. Try to apply this in your lives also. So think like a doctor now. So normally what is happening, development of the brain and the spinal cord. Brain spinal cord का development कब start हो रहा है? During pregnancy. It's starting by 3rd week of the pregnancy. 3rd week, that means in the very first month. In the very first month of the pregnancy, it is beginning. And by 25th day, my dear friends, yes, even already by 25th day, it is getting closed also. And what is happening in majority of the cases here in India, when you go to the rural places and all, when you go to the villages and all, they don't have any awareness about this one. They're not aware about that, how to plan the pregnancies, what are the precautions to be taken, what are the supplements to be taken. They don't know anything. For all these things, development of the neural tube, folic acid supplements are required. You have to start taking the folic acid now. They don't take that one. Then what will happen? Unfortunately, in the very first month, मतलब इंडिया में तो ऐसा हालत है, इतना unawareness है in the villages and all. They're not even concerned about how to plan the pregnancies and all. Done. तो वैसे ही प्रेगनेंसी हो जाता है. फर्स्ट मंथ उनको पता ही नहीं चलता है कि उनको फोलिक एसिड वगैरह लेना चाहिए. जब उसका डेफिशिएंसी हो जाता है तो देन व्हाट इज गोइंग टू हैपन, द एंटीरियर न्यूरोपोर फेल्स टू क्लोज. ये क्लोज नहीं होती है. इफ द क्रेनियल न्यूरोपोर फेल्स टू क्लोज, अगर ये क्लोज नहीं होती है, द बेबी विल डेवलप विदाउट दिस द स्कल ओवर हियर, द मेनिंजेस विल नॉट बी फॉर्म देयर, द क्रेनियल बोन्स यहाँ पर फॉर्म नहीं होते, ब्रेन एक्सपोज्ड आउटसाइड, and that condition is known as anencephaly. So what is anencephaly? Failure of closure of cranial neuropore. Similarly, अगर मान लो कि caudal neuropore close नहीं होता है, if the caudal neuropore is not closed there, then it will lead to spina bifida. Spina bifida. Spinal cord वहाँ पर close नहीं होता है. Spina bifida. अंडरस्टैंडिंग पॉइंट हियर. तो इस तरीके से आप क्लिनिकल एनाटॉमी भी अपने क्या कहते हैं आंसर्स में इंक्लूड कर सकते हो. प्लीज लुक एट दिस डायग्राम हियर. इन दिस डायग्राम इसको हम कहते हैं न्यूरल ट्यूब डिफेक्ट्स, वेरी फेमसली नोन एज NTDs. आपने ये नाम सुना होगा, न्यूरल ट्यूब डिफेक्ट्स. द फर्स्ट कंडीशन दैट इज विजिबल हियर इज anencephaly, and it is due to what? It is due to the non-closure of cranial neuropore. The second condition that you're able to see here, this one is spina bifida, and that is due to what? It is due to non-closure of caudal neuropore. Caudal neuropore. Now, what is this condition here? The cranial rachis कहते हैं इसको, rachis. You can clearly see in this condition what is happening here. First of all, are you all able to see that there is anencephaly here? Yes. पहले तो cranial neuropore fuse नहीं होता है. There will be anencephaly. Along with that anencephaly, what is going to happen? ये जो vertebrae होते हैं, अगर आपको vertebrae का structure पता होगा, तो they will be like body of the vertebrae, the transverse process, and the spinous process here. And then there will be the central canal. अब पंगा क्या है? This spinous process from both the side, it does not fuse in the middle. ये fuse नहीं होते हैं. Half from here, they have to actually fuse, but they are not able to fuse there. जब ये fuse नहीं होगा, जब यहाँ पर ये fusion नहीं होगा, तो that will also remain open. When the vertebral column is remaining open there, you can clearly see the spinal cord exposed outside. And all this shiny thing here is actually the CSF, which is leaking out there. So there is your spinal cord and that the CSF leaking out there. So you have anencephaly as well as the condition where there is a bony defect of the spines. Along with anencephaly, there will be bony defect of spine. और जब ये दोनों साथ में होंगे ना, that condition will be referred to as what? Rachis. Craniorachis. The craniorachis कहते हैं. Anencephaly along with the bony defect of the spine, craniorachis. Clear? तो चलिए एक बार दोबारा रिपीट करते हैं. If there is a failure of closure of the cranial neuropore, that is anencephaly. If there is a failure of closure of the caudal neuropore, that is spina bifida. And then, yes, anencephaly along with the bony defect of the spine, then it is craniorachis. Are you understanding the defects here? तो इसी के साथ में क्लिनिकल एनाटॉमी भी हो रहा है अपना साथ में, ठीक है ना. नाउ द लास्ट एंड फाइनल थिंग दैट आई हैव टू टेल यू हियर. वेलकम बैक हियर माय डियर फ्रेंड्स. नाउ in this diagram you are able to see the neural folds here. Guys, last and final point here. Okay, listen very carefully. Now in this diagram you are able to appreciate the neural folds here. Now in this neural folds, what is going to happen? Some of the cells will multiply and differentiate here. Some cells will multiply and differentiate, and they will be lying on the side here of the neural tube. And these cells which are present on the sides of the neural tube here are referred to as neural crest cells. They are neural crest cells. Very important. Extremely important sir. NCC, neural crest cells. ये आपके एग्जाम्स में रिपीटेड शॉर्ट क्वेश्चन और वेरी शॉर्ट क्वेश्चन आ सकता है. So I repeat again, neural folds. From the neural folds, some cells will multiply and separate apart, and they are going to separate apart in the form of neural crest cells here. अब ये neural crest cells के derivatives are actually, it's like a nonsense list. Why I'm telling you nonsense list? Why? Because after the formation of this neural crest cells, they start migrating left and right in our body, and they are going to form like so many structures in our body. You have to somehow memorize that one. Fine. अब चलिए देखते हैं कहाँ वो migrate हो रहे हैं. अब मैंने आपको ये डायग्राम यहाँ पर इसीलिए बताया है कि फाइनल क्लोजिंग में ना, दिस वन इज द नोटोकॉर्ड हियर. अबव द नोटोकॉर्ड देयर इज अ ट्यूब हियर, दैट इज न्यूरल ट्यूब हियर. Adjacent to the neural tube somewhere here will be the neural crest cells, and I am telling you about everything. And already मैंने आपको ये फिनिश कर दिया है कि paraxial mesoderm, intermediate mesoderm and lateral plate mesoderm. Are you understanding? So we have like killed it. The entire diagram we are perfect right now, every structure. So we are done with the neural tube right now. It is going to form central nervous system, whereas now we'll come to neural crest cells. Of course, it is going to form your peripheral nervous system. So number one, it is going to form all the ganglions in our body. All the ganglions, the peripheral nervous system wala part. Even the enteric plexus. Enteric, come on. Enteric nothing but the intestines में जो होता है ना, plexus, Auerbach's plexus, mesenteric plexus and all. Enteric plexus हो गए. Schwann cells also. Yes, important. I told you all the glial cells are normally formed from where? The glial cells are formed from neural tube only. But Schwann cells are not formed from the neural tube. Okay. चलिए ये हो गया आपका peripheral nervous system वाला part. Now apart from that, adrenal medulla. If you remember the adrenal gland, which is present above the kidney, और द सुप्रारेनल ग्लैंड भी कहते हैं उसको. आउटर पार्ट विल बी कॉर्टेक्स, अड्रेनल कॉर्टेक्स. इनर पार्ट विल बी अड्रेनल मेडुला. तो अड्रेनल मेडुला will be derived from where, sir? Neural crest cells. Similarly, parafollicular cells are present in the thyroid gland. They are also known as C cells, or they are also derived from where? Neural crest cells. Melanocytes, melanin forming cells, derived from neural crest cells. And most of the skull bones, even your dentine, as well as the pharyngeal arch cartilages, as well as the dermis of head and neck, and even the conotruncal septum. ये important है. ये development of heart में दोबारा आएगा. Don't worry about that. Now please look at the list here. Look at that list over there. It's like a nonsense list, I should say, because neural crest cells are like migrating left and right. They're going to so many places. They're going to form different structures. You have to memorize that. And there are like so many mnemonics available on Google and all. You can afterwards Google and see that one. I'm not a big fan of mnemonics and all. तो इसको आपको याद करना होगा. Clear with this one here? And by this, we are actually done with what here? Development of nervous system also. So, my dear friends, nervous system भी क्या होता है? By first month of the pregnancy, by 28th day, what is going to happen? Even आपका brain और spinal cord form हो जाता है. तो please take care during the pregnancies. Advise the people properly. तो you have to be like very much careful during the first month of pregnancy. Brain and spinal cord वहाँ पर form हो जाता है. Clear? So in this manner, we are done almost up to the development of nervous system in this session here, sir. ठीक है? So by this, our entire general embryology, first week, second week, and third week is done. Development of the mesoderm is done, as well as we are also done with the, development of the nervous system. Central nervous system from the neural tube. Peripheral nervous system will be from neural crest cells. Clear with this one here? I hope everything is crystal clear, my dear friends. Thank you all.